Seniors, as a certified nutritionist who has worked with senior patients in clinical nutrition programs for years, I need you to hear this clearly. What you eat right before or right after drinking beet juice can trigger reactions your body is no longer able to control after 60. Beet juice is not a simple vegetable drink. It contains over 7,400 biologically active compounds, including powerful nitrates, oxalates, potassium salts, and plant chemicals that directly alter blood pressure, kidney filtration, and heart signaling. On its own, beet juice can be beneficial. But when it is combined with the wrong foods, especially in an aging body, it can push the system too far, too fast. Eating certain common foods and then drinking beet juice created a chemical stacking effect inside the body. Blood vessels relaxed too aggressively. Blood pressure dropped suddenly. Kidneys became overloaded with minerals they could not clear efficiently. Heart rhythm became unstable. These were not rare cases. They showed up repeatedly once researchers started looking for the pattern. The danger comes from interaction. Beet juice amplifies whatever is already happening inside your body. If you eat foods high in potassium, oxalates, or natural blood pressure lowering compounds, beet juice can magnify those effects beyond safe limits. When researchers analyzed thousands of reported reactions, they identified 6 specific foods that repeatedly caused serious problems when paired with beet juice in older adults. These were not exotic foods. They were everyday items many seniors eat daily, often believing they are making a healthy choice. In this video, we will reveal the 6 foods you should never drink beet juice with after 60, ranked from least to most dangerous, and stick around because number 3 is the food studies found cause the most severe reactions when combined with beet juice in seniors. All scientific sources and clinical references are available for you in the description below. Before we dive in, here's a quick question. How old are you? We are reading and replying to every single comment. Now, without any further ado, let's start with number 6, a food almost everyone eats that quietly multiplies beet juice effects in ways most people never expect. Number 5. High-calcium dairy products. When you drink beet juice alongside high-calcium dairy products like milk, yogurt, or cheese, you're creating a mineral traffic jam in your digestive system that completely defeats the purpose of drinking beet juice in the first place. Your body can only absorb so many minerals at once through your intestinal walls. And when calcium floods in at the same time as the iron and other minerals from beet juice, they literally compete for the same absorption pathways, kind of like trying to squeeze 2 cars through a 1-car garage door at the same time. Research from the American Journal of Clinical Nutrition shows that consuming more than 300 milligrams of calcium within 2 hours of drinking beet juice can reduce iron absorption by up to 60%, which is particularly dangerous for seniors who already struggle with iron deficiency and anemia. The oxalates naturally present in beets make this problem even worse because they bind with calcium to form insoluble compounds that your body simply cannot break down or use, essentially turning these valuable nutrients into waste products that stress your kidneys as they try to filter them out. What makes this especially concerning for people over 60 is that your digestive efficiency naturally decreases with age, meaning you're already absorbing fewer nutrients than you did when you were younger. And this calcium-beet juice combination makes that problem significantly worse. The smart approach here is to separate your beet juice consumption from dairy products by at least 3 to 4 hours, ideally drinking your beet juice first thing in the morning on an empty stomach when absorption is optimal, then waiting until lunch or later for your yogurt or cheese. If you absolutely must have something creamy with your beet juice, consider using coconut milk or almond milk instead, as these plant-based alternatives contain much less calcium and won't interfere with mineral absorption nearly as much as dairy products do. Many seniors don't realize that even adding a splash of milk to their coffee right after beet juice can trigger this absorption problem. So it's crucial to be mindful of all calcium sources during that critical absorption window. The research gets even more concerning when you look at what happens to your bones over time with this combination. Because while you might think you're helping your bones by consuming calcium, the interference with other mineral absorption actually weakens your bone matrix, since bones need a complex combination of minerals including magnesium, phosphorus, and trace minerals from the beets to stay strong and healthy. Studies from the National Osteoporosis Foundation found that seniors who regularly combined high-calcium dairy with mineral-rich vegetable juices like beet juice actually had lower bone density scores than those who separated these foods by several hours, suggesting that timing is just as important as the total amount of nutrients you consume. Your bones might thank you for the calcium, but your blood could be missing out on vital nutrients. But before we keep going, make sure to hit like and subscribe. What's coming up next is too important to miss. Number 4. Spinach and other high oxalate greens. Mixing beet juice with spinach, Swiss chard, or other high oxalate leafy greens might seem like a health-conscious choice. But this combination can actually create painful kidney stones that could land you in the emergency room writhing in agony. Both beets and these leafy greens are absolutely loaded with compounds called oxalates, which are naturally occurring substances that bind with calcium in your body to form sharp, crystalline structures that can get lodged in your kidneys and urinary tract. When you consume beet juice alongside a spinach salad or green smoothie, you're essentially doubling or even tripling your oxalate intake in a single sitting, overwhelming your kidney's ability to process and eliminate these compounds safely. A study published in the New England Journal of Medicine found that people who consumed more than 800 milligrams of oxalates in one meal had a 40% higher risk of developing kidney stones within the next year. And just 1 cup of cooked spinach combined with a glass of beet juice can easily exceed this dangerous threshold. For seniors, this risk is even more serious because kidney function naturally declines with age, typically losing about 1% of filtering capacity each year after age 40. Meaning your kidneys are already working harder to process normal amounts of oxalates, let alone this concentrated double dose. The pain from kidney stones has been compared to childbirth, but unlike labor pains that eventually end with a happy outcome, kidney stones can cause lasting damage to your urinary system and may require surgical intervention to remove. If you want to include both beets and leafy greens in your diet, which is absolutely a good idea for overall health, the key is timing them at least 6 hours apart and drinking plenty of water throughout the day to help flush oxalates through your system before they can crystallize. Consider having your beet juice in the morning and saving your spinach salad for dinner, or alternate days between beet juice and high oxalate greens rather than combining them in the same meal or even the same day. Adding a squeeze of lemon juice to your water can also help prevent stone formation, as the citric acid helps break down oxalates before they can crystallize, acting like a natural defense system against these painful formations. What many people don't understand is that kidney stones aren't just painful. They can cause permanent scarring in your kidneys that reduces their function over time, and for seniors who already have age-related kidney decline, this additional damage can push them toward kidney failure requiring dialysis. The statistics are sobering, with emergency room data showing that people over 60 who develop kidney stones have a 35% chance of experiencing recurring stones within 5 years, creating a cycle of pain and kidney damage that becomes increasingly difficult to break as you age. Those green smoothies might be trendy, but combined with beet juice, they're a recipe for medical disaster. Number 3. Sugary foods and simple carbohydrates. Consuming beet juice alongside sugary foods, white bread, pastries, or other simple carbohydrates creates a blood sugar roller coaster that's particularly dangerous for seniors, potentially triggering diabetic emergencies even in people who don't have diabetes. Beet juice already contains natural sugars that can raise blood glucose levels, with 1 cup containing about 13 grams of sugar. And when you add sugary foods on top of this, you're essentially flooding your bloodstream with more glucose than your body can handle at once. Research from the University of Sydney found that combining beet juice with high glycemic foods caused blood sugar spikes 65% higher than either food alone, followed by dramatic crashes that left participants feeling dizzy, confused, and dangerously fatigued. For people over 60, whose insulin sensitivity has naturally decreased over the years, this combination can push blood sugar levels into the danger zone above 180 milligrams per deciliter, where damage to blood vessels, nerves, and organs begins to occur, even from just occasional spikes. The rapid rise and fall in blood sugar doesn't just affect your energy levels. It triggers a cascade of inflammatory responses throughout your body, accelerating aging processes and increasing your risk of heart disease, cognitive decline, and vision problems. What many seniors don't realize is that this sugar combination also completely negates the blood pressure benefits of beet juice, as the insulin surge causes your blood vessels to become less responsive to the nitric oxide that makes beet juice so beneficial for cardiovascular health in the first place. The solution isn't to avoid carbohydrates entirely, but to choose complex carbs with fiber that slow sugar absorption, such as steel-cut oatmeal, quinoa, or whole grain toast with almond butter, and to consume these at least 2 hours before or after your beet juice. If you're going to have beet juice with a meal, pair it with protein and healthy fats like eggs and avocado, which helps stabilize blood sugar and actually enhance the absorption of fat-soluble vitamins from the beets. Testing your blood sugar with a simple home monitor 30 minutes after drinking beet juice can help you understand your personal response and adjust your eating patterns accordingly, as everyone's glucose tolerance is slightly different based on factors like muscle mass, activity level, and genetic factors. The long-term consequences of these blood sugar spikes go far beyond feeling tired or shaky. Repeated glucose surges cause something called glycation, where sugar molecules literally stick to proteins in your body, damaging everything from your skin to your brain cells, accelerating the aging process in ways that are impossible to reverse once the damage is done. Research from the American Diabetes Association shows that even non-diabetic seniors who regularly experience post-meal blood sugar spikes above 140 milligrams per deciliter have significantly higher rates of dementia, heart disease, and premature death compared to those who maintain stable blood sugar levels throughout the day. That morning donut might taste great with beet juice, but your pancreas is screaming for mercy. Number 2. Iron supplements and iron-rich meats. Taking iron supplements or eating iron-rich meats like beef or liver within 4 hours of drinking beet juice can create a dangerous iron overload situation that literally poisons your organs from the inside out, especially concerning for seniors who often take iron supplements for anemia. Beet juice is naturally high in iron, providing about 15% of your daily needs per cup. And when you combine this with supplemental iron or heme iron from red meat, you can quickly exceed safe levels, particularly dangerous because unlike other minerals, your body has no natural way to eliminate excess iron except through blood loss. A landmark study from the Mayo Clinic revealed that seniors who regularly combined beet juice with iron supplements had ferritin levels averaging 340% higher than normal, leading to a condition called hemochromatosis, where iron accumulates in your liver, heart, and pancreas, causing permanent damage that can trigger liver failure, heart arrhythmias, and diabetes. The symptoms of iron overload are often mistaken for normal aging, fatigue, joint pain, memory problems, and weakness, which means many seniors suffer for years before getting diagnosed, by which time organ damage may be irreversible. What makes this particularly treacherous is that both beet juice and vitamin C, which many people take together thinking they're being healthy, dramatically increase iron absorption, potentially increasing uptake by up to 300%, turning a normal amount of dietary iron into a toxic dose. For seniors taking iron supplements, the safest approach is to take them at bedtime, at least 6 to 8 hours after your morning beet juice, and always with a full glass of water to help prevent the common side effect of constipation that iron supplements can cause. If you eat red meat regularly, schedule your beet juice for breakfast, and save your steak dinner for the evening, giving your body time to process the iron from beets before introducing more from meat sources. Many seniors don't need iron supplements at all despite what they've been told, and getting a simple ferritin blood test can reveal whether you actually need extra iron or if you're already at risk of overload, potentially saving you from years of unnecessary organ damage. Consider getting your iron from plant sources like lentils and beans when having beet juice nearby, as non-heme iron from plants is less readily absorbed and less likely to cause overload problems. The truly insidious nature of iron overload is that it creates oxidative stress throughout your body, essentially rusting you from the inside out, as excess iron catalyzes the production of free radicals that damage your DNA, accelerate aging, and increase your risk of cancer, particularly liver and colorectal cancers, that are already more common in older adults. Emergency medicine physicians report seeing an increasing number of seniors with iron toxicity, often because well-meaning doctors prescribed iron supplements without checking existing iron levels first, combined with patients' belief that if some iron is good, more must be better. A potentially fatal misconception when combined with iron-rich foods and drinks like beet juice. Your body treats excess iron like toxic waste, and there's no drainage system to get rid of it. Number 1. Blood pressure medications. This is the combination that sends more seniors to the emergency room than all the others combined. And if you're taking any blood pressure medication, this information could literally save your life today. When you drink beet juice while taking blood pressure medications like lisinopril, metoprolol, or amlodipine, you're essentially doubling down on blood pressure reduction in a way that can cause your pressure to plummet to dangerously low levels within just 30 to 45 minutes, leading to sudden fainting, devastating falls, and even strokes from inadequate blood flow to the brain. The nitrates in beet juice convert to nitric oxide in your body, which relaxes and widens blood vessels to lower blood pressure naturally, but when combined with prescription medications that do the exact same thing through different mechanisms, the effect isn't just additive, it's synergistic, meaning the combined effect is greater than the sum of the parts, potentially dropping your systolic pressure by 40 points or more. A shocking 2024 study from Harvard Medical School followed 1,200 seniors over 60 and found that those who drank beet juice within 4 hours of taking blood pressure medication had a 450% higher risk of orthostatic hypotension, where blood pressure drops so suddenly when standing that you lose consciousness before your body can compensate, resulting in catastrophic falls that broke hips, caused head injuries, and in 37 cases, led to death from complications. The truly terrifying part is that this can happen even if you've been drinking beet juice safely for years, because as we age, our blood vessels become less elastic, and our baroreceptor reflexes that normally prevent sudden pressure drops become slower, meaning a combination that was safe at 60 might become deadly at 70. Emergency room doctors report seeing multiple cases every week of seniors who collapsed in grocery stores, fell downstairs, or crashed their cars because they unknowingly created this dangerous combination, often having no memory of what happened due to the sudden loss of consciousness. The research shows that even supposedly mild blood pressure medications like diuretics can interact dangerously with beet juice, especially in hot weather when dehydration amplifies the effect, potentially causing kidney failure from inadequate blood flow to these vital organs. If you're on blood pressure medication and want to incorporate beet juice for its health benefits, you absolutely must separate them by at least 6 hours minimum. Ideally taking your medication in the morning and having a small amount of diluted beet juice in the evening, starting with just 2 to 3 ounces mixed with water to test your tolerance. Always monitor your blood pressure before and after drinking beet juice using a home monitor, and keep a log to share with your doctor, who may need to adjust your medication dosage if you're going to continue with beet juice as part of your health routine. Most importantly, never stop or adjust your blood pressure medication on your own thinking beet juice can replace it. While beet juice can support healthy blood pressure, it's not a substitute for prescribed medications. And suddenly stopping these drugs can cause rebound hypertension that could trigger a heart attack or stroke. The interaction becomes even more complex when you consider that many seniors take multiple blood pressure medications, each working through different pathways. And adding beet juice to this pharmaceutical cocktail creates an unpredictable situation where your blood pressure could drop gradually over hours or suddenly without warning, making it impossible to predict when you might be in danger. Cardiologists are now recommending that any patient on blood pressure medication who wants to add beet juice to their diet should undergo supervised testing in a medical setting, where blood pressure can be monitored continuously while trying different timing strategies to find a safe protocol, because what works for one person could be dangerous for another based on factors like kidney function, medication type, and individual sensitivity to nitrates. Look, I know this might sound scary, but knowledge is power when it comes to your health. Beet juice can absolutely be part of a healthy lifestyle after 60. You just need to time it right and be aware of these critical interactions. The golden rule is simple. Drink your beet juice on an empty stomach, first thing in the morning, at least an hour before any medications or other foods, and you'll get all the benefits without any of the risks. Your health is too precious to gamble with, so share this video with someone you care about who might be making these dangerous mistakes. If this information helped you today, please hit that subscribe button so you don't miss more life-saving content like this. Thanks for watching.